All right, so we're diving deep today on what to expect after a kidney transplant. We've got your notes and that whole presentation, and it is a lot,
A lot to take in, definitely.
but that's why we're here.
Yeah. Think of us like your friendly guides through all this medical stuff, breaking it down into plain English.
I like that.
Like almost like a nurse explaining things right there at your bedside.
Perfect. Okay, so where do we even begin with all of this information?
Well, I think it makes sense to start right at the beginning
Hmm.
with your hospital stay, which is going to be like 3 or 4 days.
Okay.
And it's really helpful to have a support person with you, especially for those last couple of
Oh,
days.
for sure, yeah. They'll be the ones learning all about how to help you once you're back home.
Right, exactly. Like two sets of ears are better than one when you're trying to remember everything after surgery.
Hmm.
And speaking of practical things, make sure you've got your medication payments all sorted out before you leave the hospital.
Oh, right. So no escaping in the middle of the night without paying the bill.
Haha, exactly. It's one less thing to worry about later.
True. Okay, so what else should I be thinking about?
Well, the good news is they don't send you home empty-handed. You'll have all the medications and supplies you need, almost like a starter kit for your new kidney.
A starter kit. I like that. It's
Yeah.
like they're setting you up for success. But then the real adventure begins with those post transplant clinic visits.
Yes, those visits, those are,
Important.
oh, they are definitely important, but maybe a little overwhelming at first because they're like super thorough.
I bet. So tell me everything. When are they? How long do they last?
Okay, so first of all, they happen every Monday and Thursday. So, get ready to mark those days on your calendar.
Got it. Mondays and Thursdays. How long do these visits last?
Plan on being there for like 4 to 5 hours.
Wow. Okay.
Yeah. But bright and early, between 7 and 9 a.m., you'll get your lab work done.
Okay.
And good news, no fasting required for these
I
labs.
thank goodness. I was not looking forward to skipping my coffee. So labs first thing, and then
And then they want to make sure you're taking your medications correctly, and then they'll answer any questions you might have about them.
makes sense. So it's like labs, medications. What else is part of these marathon clinic visits?
Yeah, the clinic itself is from 9 a.m. to 2 p.m., and you'll be meeting with a whole team of experts. So doctors, nurses, pharmacists, maybe even a social worker or a dietitian.
A whole team. Wow, that's impressive.
It is. They really want to make sure you're doing well in every aspect of recovery. And actually, get this, they even help you prep your pill box.
Seriously. That's amazing. I can see how that would be helpful, especially with all the new medications. It's like having a personal assistant for your meds.
Right. They really try to make it easy for you. And depending on your lab results, you might need an IV infusion as well.
Okay, so that's something to be prepared for. But it sounds like you're in very good hands with this team. What exactly should I bring to these visits? It sounds like I might need to pack a bag.
Yeah, it's a good idea to be prepared. You'll definitely want to bring that red binder they keep mentioning.
Oh, yeah, the red binder.
And your pill box, all of your medication, and of course your insurance card.
Okay, got it. Red binder, pill box, meds, and insurance card. Like my post transplant survival kit.
Uh-huh, exactly. And speaking of survival, let's talk about some general health guidelines, things that are really important for your recovery.
Okay, like what?
Well, let's start with skin care.
Skincare, okay. I'm all ears.
So, showering every day is really important. And when you're showering, let the warm, soapy water just run over your incision. Don't scrub it, just pat it dry.
Okay, so gentle cleansing. Can I use lotion or cream?
It's best not to put anything on your incision. No lotions, oils, ointments, or creams. Just keep it clean and dry.
Okay, so clean and dry it is. And if I notice redness or swelling or anything like that, should I call my doctor?
Yeah, definitely. If anything seems off or like it's not healing right, definitely reach out to your transplant team.
Makes sense. So showering daily, keeping the incision clean and dry, and reporting any concerns to the transplant team.
Got it. What about the JP drain? I saw something about that in the notes.
Right, the JP drain. Think of it as a little helper that's making sure everything is draining properly after surgery.
Oh, okay.
You'll need to empty it maybe 2 or 3 times a day and keep track of how much fluid is coming out.
Got it. Drain maintenance on the to-do list. Not exactly glamorous, but I guess it's all part of the process.
Right, it's all part of the healing process. And speaking of things that need to come out, what about the stent?
Oh, yeah. They're going to remove that, right?
Yeah, they'll remove the stent in your transplant ureter about 6 weeks after surgery.
6 weeks, okay. Do they do that at the clinic?
It seems like they'll refer you to a specialist, like
Yeah.
a urologist for that removal.
Okay, so different specialists, different location.
Exactly.
It seems like there's a lot to keep track of, but this is really helpful. Thank you. Oh, of course, of course. This is what we're here for. And remember, we're breaking it down step by step, and you can always come back to this deep dive if you need a refresher.
Exactly. It's a resource, not a test.
Mm.
So, speaking of resources, what about exercise and getting back to a routine after the transplant? What kind of activities can I do? And are there limitations?
That is a fantastic question, and it's one that we will delve into right after this. Okay, so we were talking about exercise and rehabilitation.
Right.
Getting back into a routine after your transplant is so important, but you really want to take it slow and steady at first.
That makes sense. I mean, it's not like I'll be running a marathon right out of the hospital.
No, definitely not.
Yeah.
Walking is actually the best exercise you can do after a transplant.
Oh, okay.
Yeah, it's gentle on your body, but it
Yeah.
still helps you, get moving and build strength.
So walking it is. And I bet they have specific recommendations for how much and how often I should be walking.
All right. Oh, they do. They do. And they might even recommend physical therapy to help you regain your strength and mobility.
Okay, so it's not just about hitting the pavement.
Yeah.
They'll really create a plan for my needs.
Yeah.
That's great. But I imagine there are some things I should avoid doing. Are there any activity restrictions?
Absolutely. For the first few weeks, you'll need to take it easy and avoid any heavy lifting. You shouldn't be lifting anything heavier than a gallon of milk.
Okay, so no impromptu weightlifting competitions. Got it. What else?
And you'll also want to avoid straining your stomach or chest muscles.
Okay.
So no intense ab workouts or bench presses just yet.
So I should focus on using leg muscles.
Exactly. Yeah.
Got it.
Yeah.
And what about things like biking or playing sports?
You'll have to hold off on those for a while. Those put too much stress on your body, especially in the early stages of recovery.
Yeah, okay.
And another big one, no driving for at least 6 to 8 weeks.
Oh, yeah.
You'll need to get cleared by your doctor before you get behind the wheel again.
Okay, so carpooling or public transportation for a while, or maybe I'll just learn to ride a unicycle.
Aha, there you go.
And what about the stretchy abdomen binder I saw in the notes?
Oh, yeah, the binder. Think of it as a supportive hug for your tummy.
Okay.
It helps protect your incision and support those abdominal muscles. And it can really help prevent a hernia.
So it's like a superhero suit for my recovery. I love it.
Exactly. Now, let's shift gears a bit.
Okay.
We need to talk about infection and rejection.
Okay. I know those are pretty serious topics.
Yeah.
But it's better to be informed.
Exactly. Knowledge is power. So let's start with infection.
Right.
Because of the medications you'll be taking to prevent rejection, your immune system will be a bit weaker than usual.
Right.
So you are more susceptible to infections.
That makes sense.
Yeah.
So what are some of the signs of infection I should be watching out for?
Well, if you have a fever over 101.5, chills, or you're just unusually tired, those are all signs that something might be off.
Okay, so basically if I feel under the weather, call the transplant team, right?
Exactly. And there are things you can do to minimize your risk of infection in the first place, too.
Like washing my hands a lot.
That's a great one. Hand washing is a superpower.
Yeah.
You also want to avoid crowds, stay away from people who are sick, and be careful around animals.
So I need to basically enter a self-imposed bubble of cleanliness for a while.
Yeah, pretty much. But the good news is that the risk of infection goes down a lot after the first 6 months.
Okay, phew. So it's not forever. Now let's talk about rejection. I know it's a big concern.
Yeah, rejection is a natural response. It's your body trying to protect itself.
Right.
From something it sees as foreign, like your new kidney.
So it's not necessarily bad, just something that needs to be managed?
Exactly. And that's where those immunosuppressant medications come in. They help prevent your body from attacking your new kidney.
Okay. But can rejection still happen, even if I'm taking the medication?
Unfortunately, yes. It's still a possibility, especially in the first 6 months after surgery.
So that first 6 months is crucial. What are some signs of rejection that I should look out for?
Well, it can vary, but some common signs are fever, flu-like symptoms, pain or tenderness over where your new kidney is, changes in your blood pressure, or even how much urine you're producing.
Oh, wow. Okay. So it's a lot of different things. And if I notice any of these, I should contact my transplant team right away.
Absolutely. Early detection is key when it comes to managing rejection. The sooner you catch it, the better the outcome.
Okay.
And speaking of those important immunosuppressant medications, let's talk about what you'll be taking and how to manage them.
All right. I'm ready for the medication lowdown.
Okay, so there are 3 main medications that you'll be on.
Okay.
Tacrolimus, mycophenolate acid, and prednisone. Each one plays a role in keeping your immune system in check.
So it's like a power son of Rio.
Right.
What are some key things I need to know about taking these meds?
Well, consistency is crucial. You have to take your medications exactly as prescribed at the same time each day.
Okay, so no skipping doses.
No skipping doses, yeah.
Got it. And I remember reading about a taper schedule for prednisone.
Right, so that just means that you'll start on a higher dose of prednisone, and they will slowly lower the amount you take over time.
Oh, so it's like a gradual step down.
Yeah, exactly. And it's important to keep in mind that prednisone can interact with other medications.
Okay, so I should be really careful about any other meds I'm taking, even over-the-counter ones.
Yes. Definitely talk to your doctor about any other medications that you're taking. And, some signs of an interaction can include tremors, headaches, changes in your electrolytes, or nausea or vomiting.
So those are all red flags to watch out for.
Exactly.
Okay. I'll be sure to keep my transplant team in the loop about any other medications.
That's great. Communication is key. So now let's talk about some general lifestyle guidelines that are important for recovery.
Okay.
First things first, you'll need to be careful about sun exposure. Your skin will be more sensitive after the transplant, so wear sunscreen, SPF 30 or higher, even on cloudy days.
No more lazy days at the beach without sunscreen.
Exactly. And this is an interesting one. You'll also need to be cautious about certain pets.
Pets? What's wrong with pets? I love animals.
I know, but certain animals, like cats, fish, and birds, can carry viruses that could be harmful to you, especially with your immune system being a little weaker than usual.
Okay, I get it. So maybe no snuggling with the furry friends for a while.
Yeah, it's best to minimize contact for a while, just to be safe. And let's talk about sex and pregnancy after a transplant.
Okay, this is definitely something I've been wondering about.
It's crucial to talk to your transplant team if you're planning a pregnancy. Those anti-rejection medications can really impact a developing baby, so planning ahead is vital.
Wow, that's so important. So it's not just about protecting myself, it's about protecting, any future little ones. What about sex in general?
Just be sure to practice safe sex and use contraception. Your transplant team can provide more guidance based on your individual needs.
Okay, so open communication is key when it comes to family planning. Do I need to tell my transplant team if I'm planning any, dental work or other procedures?
Yes, absolutely. Even routine dental work can increase your risk of infection, so you might need to take antibiotics beforehand.
Antibiotics for dental work. That's interesting.
Yeah, it's just a precaution to protect you.
Okay.
But just, keep your transplant team informed.
I'm sensing a theme here.
Right.
Communication is key.
Yes.
Now, before we move on, can we just go over the contact information for my transplant team, just so I have it all?
Yeah, of course. So you'll definitely want to have the names and numbers for your post-transplant coordinators, Grace Padrina and Sadie Capacietti.
Okay.
Grace's number is 817-250-3193, and Sadie's number is 817-250-3232.
Got it. What about the main office?
The main office number is 817-250-2443, and their address is 1325 Pennsylvania Avenue, Suite 450, Fort Worth, Texas, 76104.
Okay, so I've got the names, numbers, and address. What are their office hours?
Okay, so on clinic days, which are Mondays and Thursdays, they're open from 7 a.m. to 4:30 p.m. Tuesdays and Wednesdays, they're open from 8 a.m. to 4:30 p.m. And then Fridays, it's a half day, 8 a.m. to 12 p.m.
Okay, pretty standard business hours, except for Fridays. But what if I have, an urgent need outside of those times?
Don't worry, they have on-call coordinators available 24/7, even on holidays and weekends.
Oh, wow.
Just call the main office number and you'll be able to reach a nurse coordinator after hours.
Wow, they really do have everything covered. It's reassuring to know that there's always someone there to help.
Absolutely. Having that support is so important. And speaking of support systems, that's actually something we're going to be diving into next.
Great. Okay, so let's dive into those support systems. It sounds like having a good network of people around me will be super important.
Oh, it is. Think of it like your cheering squad.
I like that.
Yeah, they're there to encourage you, help out, and just be someone you can lean on when things get tough,
Okay, so who are the key players on this cheering squad? Family and friends? Or are there other people I should connect with?
Definitely family and friends, but you might also find it really helpful to connect with, other transplant recipients.
Oh, that's a good idea.
Yeah, they've, been there, done that. And they can offer a perspective that others might not have.
That makes sense. It's like having a mentor who's walked the path you're on. Where can I find these fellow transplant warriors?
Well, there are lots of online support groups and communities for transplant recipients. It's a great way to connect with people from all over.
Oh, that's cool, like a global network of people who get it.
Yeah.
Are there any in-person options too?
Yeah, a lot of hospitals and transplant centers have in-person support groups as well.
So whether I want to connect virtually or in person, there are options out there. That's great.
Yeah.
As we're talking about this, it makes me think about the emotional and mental side of things. Like, going through a transplant must be pretty intense.
You're right. It's a huge life event. It's totally normal to feel like a whole roller coaster of emotions.
Yeah.
And don't be afraid to reach out for professional help if you feel overwhelmed, or like you're struggling to cope.
That's a good reminder. Therapy or counseling, there's no shame in that. It's a good thing.
Definitely.
And I think it's important to celebrate the small wins along the way too.
Oh, absolutely.
Yeah.
Those little victories can make a big difference.
Exactly. So even if it's something like, I don't know, walking a little further each day or finally getting off one of my medications.
Yeah.
Or even just having a good day, I'm going to try to really acknowledge and appreciate those moments.
I love that. And remember, this is a marathon, not a sprint. There will be ups and downs, but
Yes.
you can do this, with the right information, support, and mindset.
That is great advice. It's so easy to want to jump right back into life, but I need to remember that my body has been through a lot.
For sure.
It needs some extra care.
Yes. Be kind to yourself and celebrate every step forward, even the small ones.
I will. This has been so incredibly insightful. I have a much clearer understanding now of what to expect and, more importantly, how to thrive.
Oh, I'm so glad to hear that. And remember, you are not alone on this journey. We're all here to support you.
And to our amazing listener, sending all the positive vibes for a smooth recovery. You got this.
Yes, you do. Until next time, stay curious, stay informed, and keep diving deep.